Are you thinking about testosterone replacement therapy, or if you're already on TRT, here are the blood tests you need to get. This video is going to be about the most important markers I think you should be getting if you are on TRT or pre-TRT thinking about it and want to check where your health is at before you either start or continual monitoring of your health. I do quarterly every 3 months just to make sure that all these markers are in check. In this video, I'm going to break it down by category so you know exactly what category each blood test fits into, and you can skip through the video to find what category you're interested in. Thanks so much for watching, guys. Let's get straight into it. So for the androgens and hormone category, total testosterone and free testosterone is number 1. And this gives us an idea about how your testosterone split is. So where your total is and where your free testosterone is. Some men have a very high or adequate supply of total testosterone, but a very low free testosterone, which is telling me that there's not enough bioavailable testosterone. And seeing as free testosterone is the only bioavailable form able to enter cells and exert anabolic and androgenic effects, this, I would say, is more important to be high than total testosterone. And if you are in the camp of men who have a very high total testosterone but very low free testosterone, it's usually the two culprits, albumin and SHBG. The good news is there's a lot we can do about this. SHBG, if it's too high boron, 3 to 5 milligrams a day is what I like to prescribe. And that's the cheapest and most easy thing to start, but having total testosterone and free testosterone is the most important marker to get done here. Estradiol E2 is number 2. Now, men who have higher body fat percent levels tend to aromatize a lot of testosterone into estrogen. The enzyme that does that is very highly prevalent in body fat tissue or adipose tissue, and E2 actually exerts stronger negative feedback on the HPT axis than testosterone. And it's why it's a good idea if you're pre-TRT to check estradiol, because you might have really high estrogen that's exerting a big negative feedback on your HPT axis, meaning it's telling the body not to produce as much testosterone, and getting that in check might actually boost your testosterone without jumping the gun straight onto TRT if you could get your estrogen in check first. And this is why things like SERMs, like clomiphene and enclomiphene, work really well, because they block E2 receptors in the body and they block estrogen exerting negative feedback on the pituitary gland. Hence, the body is tricked in a way into thinking that estrogen and testosterone are low, so it pumps out more LH and FSH to boost up testosterone. So if you're getting your blood tested for the first time and your estrogen is sky high and you have a lot of adipose tissue or fat on you, this might be a strong reason why your testosterone is low. And I've seen a lot of guys just fix up their diet and lifestyle to drop body fat and significantly boost their testosterone levels 20 to 40%. LH and FSH are good to check, the gonadotropins responsible for testicular activation of the HPT axis, and checking where these are gives us a good idea about how well your pituitary and your hypothalamus in the brain is working. So it sort of gives us an idea about whether it's a testicular issue or a brain issue, and can help us in the diagnosis of any signaling issues to the testicles and primary and secondary hypogonadism. SHBG and albumin are the two proteins responsible for binding testosterone. SHBG very strongly and albumin a bit weaker. But like I said earlier, men with good total testosterone levels but very low free levels, these might be culprits that are super high, binding up all the total testosterone and not letting any free testosterone float around the body to exert its effects. Knowing where these are is really important, especially I would say if you're thinking about testosterone replacement therapy. Prolactin gives us an idea about your pituitary gland health. Abnormal prolactin levels may be caused by tumors on the pituitary gland, and if left untreated, these can cause infertility in women, but more importantly for us guys, loss of sexual function in men. And in men, high prolactin levels can lead to a decreased sex drive, difficulty in getting an erection, breast tenderness or enlargement, and in very rare cases, breast milk production in men. Knowing where these levels are and if they're very high is cause for fixing that issue before thinking about testosterone replacement therapy. Cortisol plays a role in controlling your blood sugar, memory, and blood pressure. And it's good to add that in to see if the cortisol is following its usual rhythm, higher in the morning, lower at nighttime. Vitamin D is good for calcium control and bone health. ACTH is a hormone produced in the front of the pituitary gland in the brain and is produced to regulate cortisol. So checking this alongside cortisol is really important too. DHEA and pregnenolone are vital neurosteroids. Now, if you're taking TRT, you're not just turning off testosterone production, you turn off the whole cascade from cholesterol all the way to testosterone, and there are vital neurosteroids in that pathway, embedded in that pathway, that are turned off when LH and FSH signaling come to zero. Now, for some men, this is not an issue at all, but for a certain subset of men that I've seen, they sort of struggle when these neurosteroids are turned off, and they just feel a bit worse off than they were pre-TRT. So if you're on testosterone and not feeling 100% cognitively, or you're feeling just a bit off, it could be a good idea to check these vital neurosteroids, which are involved in memory, cognitive decision-making, cognitive function, and making sure these are in check can really help optimize your health when on testosterone replacement therapy. And a lot of guys find that DHEA and pregnenolone is like the missing piece of the puzzle and can restore a lot of cognitive function. DHT, so if you're finding you have significant balding on testosterone replacement, or if you have a significant receding hairline, you could be converting testosterone to DHT at a very much increased rate. Some people genetically do this already, but 5-alpha reductase is the enzyme responsible for converting testosterone into its much more potent form, DHT. This is more a concern for the guys on topical testosterone gel, because 5-alpha reductase is found very highly prevalent in skin tissue. So when you apply testosterone replacement in a topical form, like a cream or a gel to your skin, you're getting a huge amount of conversion from testosterone to DHT, and this can really affect your hairline if you're genetically predisposed to male pattern baldness. But checking where this is important, and I would say more important for the guys on topical TRT. And the final one in this category is IGF-1 and growth hormone. Checking these levels can show any deficiencies in your body's ability to promote normal bone tissue growth. And deficiencies here, along with low testosterone, can be indicative of a central cause of hypogonadism, meaning the brain is not releasing hormones. So it could be something to do with the pituitary gland. All right, the next category, and most important, I would say, is heart health category. So the first one is CRP, C-reactive protein. It's a marker of inflammation in the body and is produced in the liver and is measured in the blood and gives us an idea of how inflamed you are. Studies have found a strong link between high levels of CRP and cardiovascular complications, so stroke, heart attack, and coronary artery disease. And ensuring this is low is critical for long-term health and optimization on TRT, or even naturally. Cholesterol, triglycerides, HDL, and LDL, and sometimes for some guys on heavy cycles, very low density lipoprotein, so VLDL. Now, cholesterol, like I was saying earlier, is the precursor to testosterone production, so it can be low if you are on a very low-fat diet, for example, in the middle of an aggressive cut, and this is why extreme bodybuilders often have very low levels of testosterone, because their cholesterol is so low. The body literally has no precursor molecule to actually create testosterone through the steroidal pathway. Glycerides are a type of fat in the blood, so keeping this within reference range lowers heart disease risk. HDL shuttles cholesterol back to the liver, whereas LDL delivers it away from the liver, and LDL can lead to plaque accumulation, especially if I ask guys in the coronary arteries is going to be huge to maintain and check that. Now, testosterone is very well known to lower HDL levels and raise LDL levels, predisposing us, and this is more a concern for the guys on cycle and on heavy anabolic or PED use. You're going to have crashed HDL and very high LDL, which is putting you at risk for plaque accumulation. There are a few things you can do to offset this and lower your LDL and raise your HDL. For the sake of keeping this video somewhat short, I'm not going to talk about those supplements now, but if you're interested in those, just drop me a message below and I'll respond with the HDL subs that I like. And if LDL is significantly high, I would also recommend putting in VLDL. Breaks the LDL value down into subfractions. Basically identify the subfractions of your LDL value based on the size, density, and electrical charge, and give us a better idea about your true risk of heart disease and atherosclerosis. Apolipoprotein A1 and B, plus the ratio of these. ApoB is a primary component of LDL. The ratio in the research has been shown to be a very powerful predictor of heart disease risk. This is one of my non-negotiables on blood work for anyone who comes to me, because it is such a key predictor of if you're at risk of having a heart attack or developing plaque and atherosclerosis in your coronary arteries. Homocysteine, higher than normal levels of homocysteine have also been linked to an increased risk for the development of blood clots, heart attack, and stroke. So it's good to include this one too. And checking this alongside CRP are really important for checking inflammation in the body. Okay, the next category is kidney health. So for the kidneys, I'm going to check the kidney function tests. Now, a lot is covered here, but the most important will be urea, creatine, and EGFR. So making sure that your kidney is filtering your blood at healthy levels gives a really good indication that they are working well. This is more a concern for guys pushing heavy amounts of nephrotoxic drugs, particularly boldenone and trenbolone, than it is for guys on TRT, but it's still good for us, even if you're just thinking about TRT, to check your kidney health. Also important here is that your blood pressure is low, because this will reduce stress on your kidneys over time. So 120/80 is the gold standard, and I would say anything over that is actually putting you at significant risk. I always talk about this study, but it's a huge longitudinal study, and it showed an exponential relationship between blood pressure and heart disease risk. So keeping your blood pressure below the threshold of about 120 millimeters of mercury on 80 diastolic is going to be huge for keeping not only your kidneys safe, but your entire body and your health. Do everything you can to keep your blood pressure low on TRT, and don't feel ashamed if you can't do it naturally. If you have to use a blood pressure medication like telmisartan and ARB or some other form of blood pressure medication, keeping your blood pressure low will directly add years to your life and keep you safe and healthy for longer than you would be if you were walking around with like 140/80 chronic high blood pressure. Now, if EGFR and your creatinine levels are out of range, I would then go and get a cystatin C test. Cystatin C is a protein which is filtered through the kidneys, and it's a bit more specific for diagnosing kidney issues. So increased levels here typically indicate that the kidney's glomerular filtration rate is impaired, and it's a really good indication of how bad the damage is to your kidneys. Now note, this isn't actually needed in 99% of men on TRT, and I'd only actually recommend this if your creatinine and your EGFR are way out of range, or your EGFR is very, very low. Then I would go and get a cystatin C test. The next category is your liver health. Now, liver function test is the most important here. So this gives a good indication of your liver health: AST, ALT, bilirubin, GGT, total protein. They're going to be the most important, and it's important to see how hard your liver is working, and it shows any enzymatic or otherwise damage that may be impairing your liver function, especially because testosterone esters, if you're doing injectable testosterone, is cleaved off in the liver. You want to make sure that the liver is being able to take this anabolic load, cleave off the ester, and release testosterone into the bloodstream well. Keeping your liver healthy will directly allow you to do this more efficiently. The next category is thyroid health. So you want to check your TSH, your free T3, free T4, and your reverse T3. This gives us an idea about your thyroid function and whether you are normal or underactive or overactive. T3 and reverse T3 are important to check, as T3 is the active form of the thyroid hormone, in that it mainly influences a lot of bodily processes that are really important, and in particular our metabolism. So bodybuilders that have just finished a heavy prep cycle with very low calories, you kind of get the idea, and this is what I'm talking about in terms of metabolic health. Prostate health is a really non-negotiable for guys on TRT. TRT doesn't increase your risk of prostate cancer, but you do want to make sure every so often that your PSA is in range. This measures a protein that is produced by the prostate gland, and although it can be indicative of potential cancer, it's not always. So having it high doesn't mean you have prostate cancer, but you do want to keep it low for long-term health and optimization on testosterone replacement therapy. And then the final category is your general health, or I like to just call it the general category. This is stuff that doesn't really fit in, but just stuff that I've added on over the years just to make sure that everything's functioning as normal and to optimize on TRT. So your full blood count, a lot is covered here, but the most important will be looking at your red blood cell morphology and physiology, so the actual structure of your RBCs themselves. TRT can raise red blood cell count, and hematocrit will be vital to check here. Now, hematocrit is the percent of your blood that is made up by red blood cells. Now, guys pushing 55% plus HCT levels are going to be at increased risk of blood clotting, and having very thick blood is not good on TRT. Although TRT won't really do this, it'll be more like the steroid cycles. But keeping your blood thin is vital for longevity and health. Now, donating blood is always an option if you can't keep this under control, but this is why I also like to include iron, because it can crash your iron levels. So iron studies is a really good test to get. Iron being an essential component of hemoglobin, and in some men, TRT can raise levels in the blood. So checking this is just a really good way to ensure completeness and complete optimization. Vitamin B12 for general health, DNA health, blood and nerve cell health. Creatine kinase for the guys who train hard and are turning over large amounts of muscle mass. CK is a good value to check, and it will likely be high because it's the enzyme responsible for muscle mass turnover. I've seen up to 10 times the reference range here for guys who train really heavy, but it is good to know just how far above range you are, and it can give you an indication of how much load you're putting on your kidneys in terms of muscle mass and protein degradation. Fasting glucose and HbA1c. This gives us a good idea about your insulin sensitivity and risk of diabetes, as well as basically how well your body is managing its glycemic and glucose control loads. And you want your body to be very sensitive to insulin so it doesn't have to produce huge amounts of insulin that could be sort of pre-diabetic. The other benefit here is if you are more insulin sensitive, then insulin directly turns on mTOR, which is the huge regulatory process responsible for building muscle mass, as I speak about in this video. So it's sort of like a way to be both anabolic, but also ensure that your body can manage its glucose really well and you're not at risk of pre-diabetic or diabetes. And finally, finishing with Z, to finish this video, zinc is the last one. Zinc is an important mineral required for a number of bodily functions involving energy and metabolism, and it's necessary for a strong immune system, normal growth, cell reproduction, and the healing of wounds. Zinc also is really important for the natural guys. If you're thinking about TRT and your zinc is low, zinc is very important for the enzyme processes involved in converting cholesterol all the way down to testosterone, and making sure that your zinc is adequate can actually boost your T levels quite a bit. I've seen up to 15% improvements in T levels just by guys who are low in zinc, supplementing zinc, getting those enzymatic processes going again, and getting cholesterol turned back into testosterone in a much more efficient way. So it's really good to check this one. Guys, that's the completion of this video. All the blood tests you need if you're thinking about TRT, if you're on TRT, or if you're even just natural and want to optimize your health in the fitness industry. Thanks so much, guys. Really appreciate it. I hope some of these blood tests will be helpful for you. And I really wanted to create a comprehensive list that you can take to your medical provider, get checked, and know that you're putting your health first and you're checking all the levels that are vital to optimize your journey on TRT, like I said, or even naturally. Thanks so much, guys. Fitness Doc. I will see you in the next video.